Namaste friends. Welcome back to our channel dedicated to the science and art of homeopathy. Today we are going to explore one of the most vital tools in homeopathic practice, that is repertorization. Every homeopathic physician faces the challenge of connecting a patient's unique symptoms with the correct remedy from our vast materia medica. So, how do we build this bridge between the patient and the remedy? That bridge is repertorization. In this video, we will understand what repertorization really means, why it is so essential, and how it helps us reach the simillimum accurately and scientifically. Now first we will see what is the definition and meaning of repertorization. So the repertorization means the systematic process of analyzing a case using a repertory to find the remedy that most closely matches the totality of symptoms. It is not just a mechanical counting of rubrics, but a scientific evaluation of the case that guides the physician towards the simillimum. Repertorization is the scientific process of analyzing and evaluating the symptoms of a patient with the help of repertory in order to find the remedy that best matches the totality of the case. It is a crucial step in the homeopathic prescribing that connects the language of the patient with the language of the materia medica. The term repertorization comes from the word repertory, which means a systematic index of symptoms and the remedies related to them. Hence, repertorization means working with the repertory to select the most similar remedy. According to Dr. J.T. Kane, repertorization is an index to the materia medica, a guide to the selection of the remedy on the basis of symptom totality. Now, why it is called the bridge between patient and the remedy? In homeopathy, the patient expresses his sufferings in the form of symptoms, either mental, generals or particulars. But the materia medica describes the remedies in the language of provings. To connect these two, the patient's expressions and the drug picture, we need a repertory. Thus, the patient gives symptoms. The repertory converts these into rubrics. The repertorial analysis points towards the remedy. Hence, repertorization becomes a bridge between the patient and the remedy, allowing the physician to reach the simillimum in a logical and unbiased way. Now we will see the steps in repertorization. The first one is a case taking. Collect or complete and detailed symptoms of the patient. Then comes the case analysis. Here classify the symptoms as generals, particulars or mentals, etc. Then comes the selection of rubrics. Here translate symptom into the repertorial language, means rubrics. Then comes the repertorial work. Use a manual or computerized repertory to find the indicated remedies. Then comes the evaluation of the remedies. Study the grading and frequency of remedies under selected rubrics. Then comes the final selection. Verify the top remedies in materia medica to confirm the simillimum. Now we will see what is the importance or therapeutic value. Repertorization helps to find the most accurate remedy when many medicines appear similar. It makes the prescription logical and scientific, not mechanical. It reduces the personal bias or guesswork. It helps especially in chronic and complicated cases. It strengthens the link between the theory, means materia medica, and practice, means clinical case. Now we will see one example. A patient complains of fear of death. Then there is a restlessness. Then there is a thirst for small sips of water. Or there is an anxiety about the health. These symptoms, when translated into the rubrics and repertories, point to arsenical, which when confirmed from the materia medica becomes the indicated remedy. Now we will see the concluding part. To conclude, friends, repertorization is not just a technique, it is the heart of the scientific homeopathic prescribing. It helps us to translate the language of the patient into the language of the materia medica. By understanding and applying repertorization correctly, we move beyond the guesswork and make our prescription precise, rational, and reproducible. So remember, every time you repertorize, you are building a bridge from the suffering patient to the healing remedy. Stay tuned for our next video where we will discuss the steps of repertorization in detail with the practical example. Thank you.